196 consultants we have in Galway have signed a letter to the Minister for Health calling for the development of a new hospital in Galway, describing the current facilities as unsafe and unfit for purpose. The top-level correspondence has lent considerable support to the ongoing campaign of Fine Gael's TD Hildegarde Naughton, who has been leading calls for a new hospital in Merlin Park. And Deputy Naughton joins me on the line. Deputy Naughton, good morning to you.
Good morning, Keith.
196 consultants is an awful lot of consultants for such an unfit facility.
Yes, this is a significant statement by senior clinicians in Galway asking the Minister for Health, Simon Harris, for urgent approval to proceed with an options appraisal. So the Minister has written back to the Sale the Hospital Group, to Dr. Pat Nash, the Senior Clinical Director there, giving that approval. I know the options appraisal is actually underway. So this is laying out a medium, long-term strategic vision for the healthcare needs of Galway and the entire region.
But Hildegarde, hang on one second, because Pat Nash, as Clinical Director for the hospital, sat at the Oireachtas Committee and said at that Oireachtas Committee that the building was unfit for purpose. So there was no need for the 196 consultants to write to him, because he's the one that blew the lid on this.
Yes, he did. He came before the Future of Healthcare Committee, and I suppose that committee was looking at the whole of the country and the requirement for more bed capacity with our ageing population and all of that. And although we do need more primary care centres and more facilities in the community that will relieve hospitals and relieve the capacity issues in hospitals, we're still going to need more beds, and particularly in the west, because Galway, as we know, was designated a centre of excellence for the region, and it's catering for over 800,000 people in a number of different counties right across the western seaboard, from Donegal, Leitrim, Sligo, Mayo, Roscommon and Galway, and also Clare and Mayo. But the infrastructure hasn't been invested to meet those demands. So I suppose what's important about this letter is that it's clinician-led. The Sale the Group is engaging now in a strategic vision that it will be sending to the Minister after this options appraisal has been completed. And I think this is a very important statement coming from clinicians. As we know, the hospital itself was built back in the 1950s. It's on a congested site. I don't need to tell any of your listeners or people who are going in that the staff are working so well, and this is not an issue about staffing or qualifications. They're working so hard on the ground, but the infrastructure has to be invested in order to meet the increasing demand.
Just looking at it, there's so much money. Would it be fair to say billions has gone into that site, and now we're looking at going to a greenfield site in Merlin Park?
Well, this is what the options appraisal is going to be assessing. There has been a lot of investment on that site, the clinical research facility.
Look at the 75 new beds, and the new ED department that needs to go in there. Is that just throwing good money after bad in the short term?
Well, and that has been highlighted in the letter by clinicians, and they acknowledge the need for a new A&E, that they do need to have that investment, because that will take 2-3 years. This would be a longer term plan with regard to if it was a new acute hospital, but we can't wait for that longer term investment. We need to be looking at medium term solutions, and part of that is a new A&E, and the Minister has acknowledged that in his reply to Dr. Pat Nash. The clinicians need to lead on this. They're the experts, they're working in the field, they know the system, they know the best location and the way that, I suppose, if it was a dual site or one site, how that would work. For what it's worth, my own opinion is the Merlin Park site is state-owned land. There's over 150 acres there. We own the site, the zoning is correct, there's already a hospital there, and it's working in conjunction with the UHG site, but that's not for me or anyone else to decide. That's what the options appraisal is going to assess. It will be led by Dr. Pat Nash, the Sale the Hospital Group, and that will be going out to tender. So that, I hope, would be completed by the end of this year. And that's what proper planning is about. It's not about politicians interfering or saying where something should go. I think we've gone down that road in the past, and it has worked against patients, citizens and the healthcare system. We need to be making sure that this is clinician-led, and I think that is the importance of this letter from Dr. Pat Nash and the 196 clinicians. They have said from their own expertise that we need to be looking at a long-term strategic vision for acute hospital services in Galway. I think we need to let them do that, lead on that, and then go back to the politicians, to the likes of ourselves, the Minister, and we should then be in a position to support them in that, because that is the best way to go about planning for our health service and ensuring that the needs are adequately met.
In relation to the 196 consultants, with all due respect to them, and they're very talented people, and we're very lucky to have them. But surely this should be independent of the clinicians and politicians.
They will be engaging in consultants to carry out the options appraisal, and I know that Dr. Pat Nash has already engaged in that. I understand it's gone out to tender. This is to complete the options appraisal. This is the professional, proper way of doing it. So what has happened in Galway to date has been very ad hoc. We've just built, and people can see it when you go into the University Hospital site. We've been building on, demolishing buildings, building on top of car parks, no proper planning, no proper infrastructure. People can't access it, they can't get parking. So we really need to be looking at this afresh, and I think this is what is significant about this process at the moment. It's an options appraisal, clinician-led, and I have complete confidence in Dr. Pat Nash as clinical director that he will be steering that in the best way possible, not only for Galway, but the 6 counties that we serve, with over 800,000 patients coming from right across the region, who are coming to Galway because that's the centre of excellence, but the infrastructure has not been put in place in order to meet that demand.
And I agree with you, but I'm not disagreeing with you. Pat Nash is a fine guy. I'm just wondering, is this the proper way to move forward, or should the Department of Health just say, guys, we're going to a greenfield site in Merlin Park or elsewhere? And I mean, that would free up very valuable land very close to the city centre for social housing, etc.
Yeah, I suppose you can't make a decision until there's a plan and an assessment and all the options and evaluations take place, and that's what this options appraisal is doing. And I think that's what's important about this. The last thing we want.
How long will it take, though, Hildegarde?
By the end of the year, I'm hoping the options appraisal will be completed, and it will be a number of years. We have to be realistic, and in the meantime, we do need to be working on the A&E, Accident and Emergency Department, and as interim measures. But if we don't have, it's like anything, if you don't have a long-term plan, we're going to be going from year to year, crisis to crisis, and I'm delighted to see that the Sale the Hospital Group are taking the lead on this. This is a key priority for me. We need to be looking at a new acute hospital for Galway and the West. And this isn't just about Galway, as I say, it's right across the Western region. And this is the time now to start planning. If we don't put this plan in place, we cannot be looking for investment if there's no proper strategic vision. And that's what's taking place here.
All right. Deputy Hildegarde Naughton, thank you for joining us today on the programme.